Lars, the first day of the SCMR is almost over. What have been your highlights, and what are current hot topics in research when related to CMR in kids and in congenital heart disease?
So I definitely think what's spilling over into the pediatric arena is definitely tissue characterization. We're learning a lot from the adult world in applying tissue characterization. T1 mapping is definitely on the verge of going into pediatrics because a lot of the pediatric diseases that we encounter are definitely going to produce fibrosis in the heart, and that is something we're very interested in. I think we're only tapping the surface of 4D flow vascular physiology. People have been investing a lot of time into that field, and I think we're going to see a lot more of that. And another topic that I think we're only scratching the surface of is fetal cardiac imaging, especially flow measurements in the fetus.
You have been responsible for the contents, congenital and pediatric CMR here at the conference. So have you seen a development over the recent 2-3 years? Any changes in that field in terms of the use technology or the questions asked?
So I would say overall the trend over the last few years has been that people are thinking a lot more hemodynamically. It used to be that anatomy imaging is what people do, especially if they have a radiology background, but it's quite clear that people have evolved into thinking very functionally oriented, and they use cardiac MR to really tease out the function of the heart and the circulatory system, and not so much be stuck on sort of anatomy and try to infer the function from that.
So you think for the next years we will see more of tissue characterization and more of flow-related research?
Absolutely. I think the big trend also in pediatric cardiac imaging is combining different imaging modalities. It becomes quite clear that even MR has its limitations, and we need to supplement it with what echo and CT can do. So I think we'll be seeing a lot of approaches that take the best of both worlds into their...
In your institution, can you give a rough estimate how much of the diagnostic workup when it comes to advanced imaging is done by CT as opposed to MR?
Absolutely. So in our institution we do about 600 cardiac MR cases per year and about 40 cardiac CT cases. So it's very limited. And that's mostly related to us feeling very, very comfortable with cardiac MR. We do feel comfortable with cardiac CT as well, but obviously we try to avoid ionizing radiation.
Okay, so when you go to work next week on Monday, what will be the first thing you do when it comes to cardiac MR? Some research, clinical application, or what will it be?
Well, the first thing I'm going to do is restructure my T1 mapping protocol, because after yesterday's session I've definitely learned that I have to adjust some of the settings in my program. So that's probably one of the first things I'll try to do.
Thanks for stopping by, and all the best for your great work.
Thank you very much.
Lars Grosse-Wortmann from St. Kitts Hospital in Toronto, and this is History for CBI Plus.